apologize. I have a little bit of laryngitis. I was picked to moderate because of my angelic voice, but I'm sorry. We'll not hear it this evening. So this is a really fun event and getting a chance to hear a discussion on some pretty exciting topics in a vibrant and very dynamic healthcare space that we live in today. So I'd like to start, so the panel is focused on payer-provider perspectives on innovation. I'd like to start by having our panelists introduce themselves and get into a discussion. So Gina, can you start, please?
Sure. So my name is Gina Villani. I'm, that was loud, sorry. Director of Diversified Business Group at Blue Cross Blue Shield of Massachusetts. I've been with Blue Cross for almost 13 years now, and started with the company in an entry-level role in member service and kind of found my way through the organization in a variety of support and leadership roles. I joined our company's strategic investments group 4 years ago, and by group I mean team of two. And we looked at investment opportunities in companies who had products or services that support our core business of offering health insurance. So the work that we've done has grown over the years, and we're now part of a newly forming diversified business group, so there'll be more folks looking at similar types of opportunities, and I think that's about it.
Great. Lawrence?
Sure, I'm Lawrence Stuntz. I'm the director of the Massachusetts Ehealth Institute. And just for a show of hands, how many folks are aware that we've got in Massachusetts a public agency that's job is to advance health information technology adoption and economic development in e-health? All right, about 20% of the audience. And about how many of you are actually aware that that's us? All right, so about half of the remainder, or half of those folks. So the Ehealth Institute was founded by an act of the legislature in 2008 as part of our Massachusetts ongoing health reform activities here, and basically, the legislature recognized that technology is a key piece of reform. It's obviously not sufficient, but it is a key enabling factor. And so our job at the Ehealth Institute is to act to push forward technology. So we're working in a variety of areas. We're the Regional Extension Center for Massachusetts, which has helped over the past couple of years, helped about 2,500 physicians adopt electronic primary care physicians and nurse practitioners help adopt electronic health records. We're help a whole bunch of hospitals adopt, and we're moving that area of focus into behavioral health, mental health, substance abuse, as well as long-term post-acute care. We also are helping drive community adoption of health information exchange, helping to support physicians in achievement of meaningful use. And specifically for this audience, we have, as part of our core broader mission, we're part of the Mass Technology Collaborative, which has been around 30 years as an economic development agency. We're specifically interested in economic development around the e-health industry. So Massachusetts definitely has the largest e-health industry in the country, regardless of what the folks in California and San Francisco say. There's over 200 e-health companies headquartered here in Massachusetts, and that doesn't mention all the folks who are moving in right around here, like Optum Labs, IBM, Microsoft. There's some really powerful accelerators. Blue Cross has invested in HealthBox. I think they're starting up their third class, is that right, this spring? And so we really have a vibrant industry. So while I'm not, and our organization is not primarily a buyer of technology, part of what we do and what we want to do is help understand what those buyers need, and help bring that clarity to the marketplace to all of you who are starting up companies so that we can really grow this industry even further. So that's us.
Great, no, thanks, Lawrence. And I think that's actually a great segue into the discussion that we'd like to have over the next 20-25 minutes, and that's focused on a changing landscape in healthcare, and where I sit from a venture capital perspective. For the most part of the last decade, our focus has been about developing product opportunities and services that were bigger, faster, cooler, but not necessarily more cost-effective and value-based. And that's a rapidly changing dynamic. And I love the panelists to really highlight where they see the opportunities are for innovators in this changing healthcare landscape. So I'll turn it over to you, Gina.
Sure, that's a great question, and I think to Lawrence's point about being a buyer, there are opportunities for Blue Cross of Massachusetts to be a buyer, but when I think about us looking at startups and looking at innovation, I see it more as a support role that we could play in helping our stakeholders. So for us, that would be largely two groups, how I would count them, would be one being the provider community, and two being members, accounts, patients, all those kind of constituents lumped together. So for us, a lot of what we're doing, particularly through our partnership with the Health Box programs that we've had thus far, and as we're continuing to look to the startup community, is to look at what kinds of technologies out there can make life easier for our providers, particularly as Christina spoke about, the ones in our accountable care organizations. So she made my job a lot easier, by the way, because if I had to explain accountable care organization, it wouldn't have been nearly as eloquent as her presentation was. But she talked about Blue Cross gives a statement quarterly. Here's your claims feed. So what is a provider group to do with that claims feed? And how do they take that data that they're getting and turn it into something actionable that they can take this information and they can save money this way, or they can take that information and improve their quality and improve their patient care in a certain way. So that's one example out of many about what we would be looking for. And in terms of working with startups, that's something that's very new for us. So we're about 76, 77-year-old insurance company. We've really been working with startups for 2 years. Through our partnership with HealthBox is really how this got started. But we see that there's definitely a need for healthcare innovation, and we would like to be a part of that to support not only ourselves as a company, but our constituent groups. So there's a lot more work that we're going to be doing around innovation in healthcare going forward. So I think that there's a lot of opportunity, but we're kind of letting the providers and the members dictate to us what they need so that we can help facilitate that process.
And are you hearing specific requests from those providers around what are they clamoring about is painful for them on a day-to-day basis?
Well, I think so. Some of the ACO stuff that Christina talked about in terms of the data is one of the things I just saw in the Boston Business Journal too the other day. Some of you might have seen is that in Massachusetts there was a report that came out and they're predicting big data jobs to grow by 4,000 in the next year because there's so much information that lives everywhere, and there's no one system or source or opportunity that pulls that together and that can really drive action. So that's one thing is meaningful data and not just data in and of itself. So I think there's also a lot of opportunity to help them triage patients more effectively. So we've had healthcare reform in Massachusetts for a number of years now. So our patient pool as a whole has grown tremendously, and the number of physicians has not grown to match that number. So how can one single doctor better manage their growing pool of patients? So we have some technology that we've invested in through the HealthBox program that can help providers triage and better determine which patients are a priority to see so that they can get to the sicker patients quicker.
I just want to jump in specifically on that. Commonwealth Fund this morning released a report on every 50 states and how across the country people are doing. Massachusetts was number one in healthcare equity, healthcare access, healthcare, forget the other two dimensions that we were number one in, and we were number 30 in avoidable hospital care and costs. David Blumenthal, who was the Office of the National, the coordinator, Office of the National Coordinator, and is now leading the Commonwealth Fund, that specifically, that problem is what keeps Christina awake at night. Just understanding who those folks are that are going into the hospital. So if you can provide tools and solutions that help move us from number 30 in that area, we're down at 42 in in some of the specific areas, specifically around avoidable hospitalizations, avoidable use. Some of that's cultural, as Christina mentioned. We definitely have a lot of access to care. Virtually every hospital participates in virtually every network, and it makes big news when Blue Cross and Partners agree to talk about fighting about a contract, or Tufts Health Plan, and I forget who they were recently fighting with. But when that makes huge news for us. So avoidable hospital costs. There's a couple of other key areas that I see when I'm talking to folks, in the area of meaningful use. Every physician in a hospital is thinking about meaningful use. So the key pieces there are integration of their data with everybody else. The health information exchange is a key piece of that. Patient engagement is a key piece of that. So tools and technologies that can help a provider really bring their patients in to and help make sure that they stay healthy. Those types of tools are a key piece of meaningful use. And quality measurement. Christina talked about the single central provider toolkit that gives a physician a good sense of where they are from a quality perspective. That's going to be a killer app for somebody who's interested in meaningful use pieces. So I didn't want to jump in, but
You mentioned quality. I think one of the things that Christina mentioned that was striking to me was how there was such non-overlap in quality metrics amongst the various payers, and I don't know if you're seeing anything out there around some potential approaches at trying to arrive at some element of making that more unified in how we think about quality metrics, and is that an opportunity?
It's a huge opportunity for reduced waste. The folks asking for all these quality metrics are, I guess I don't know enough. I don't know whether you have an opinion on why Blue Cross asks for different ones than CMS versus, it's a really new area. I think from an innovation perspective, it's, if you could extract all of those out of the EHR data that are available to allow for reporting of those, that would be an innovation opportunity for companies to be able to make good sense out of all the unstructured data that's available in an electronic health record and in the data feeds that providers get, and turn that into quality data that can be reported out for these various contracts. That becomes a piece of it. Part of, frankly, the things that we think about at the Ehealth Institute and work on are to try to reduce the number of quality metrics. Boston Public Health Commission came up with a whole bunch of ones that they wanted that are different than the folks that are, so all the hospitals and community health centers in Boston were a little bit peeved because they frankly don't capture whether somebody's transgender today in many of their EHRs, which is what Boston Public Health Commission wanted to be one of the many data elements that Boston Public Health Commission wanted to capture.
I would blame other payers because we did the contract first. But seriously, I was surprised to see that. I myself was not aware that there were multiple quality measures. I guess I kind of took for granted that there would be some sort of a set. But that's where we're still trying to dig into what the opportunities are and where we might be able to help, because there's a lot of opportunity out there. So, part of what we're doing now is really trying to prioritize where we might want to spend the most of our attention and what might be most beneficial quicker for providers and for consumers as they're trying to navigate a lot of these changes. But that was a surprising data point to me.
One of the things that Lawrence mentioned was around this concept of patient engagement. I wondered, Gina, what does that mean to Blue Cross, and how important is that to the organization? Are you thinking about ways to invest in those areas to promote those areas?
That's a great question. So prior to my time in the strategic investments area at Blue Cross, I spent 9 years in our member service team and was leading call center teams down there. And so a lot of our experience in the early 2000s, our mantra was to take members out of the loop. So you didn't understand how your health plan worked and you got a bill, you could call me, I would say, no problem, I'll take care of that for you. That was almost a script. We didn't tell you how or why it worked a certain way, because for us it was more important at that time to have a concierge mindset and to want to take care of the problems for our members. And what we discovered as we, moved past that is this isn't working, because in a consumer-directed healthcare world, now you have patients, members, whatever you want to call them, we call them members. Now you have members who are getting deductibles, who've never seen a deductible before. They don't understand what they're getting a bill for, why they're getting it, because a lot of us here remember the days of a $5 office visit copay. Never had to worry about cost before. So when we talk about consumer engagement, a lot of it is around education, awareness, understanding of how my plan works, why I need it, what features I need, and how can I navigate the system so that I can get the care that I need at the right time, but still make the right decision from a care perspective, from a financial perspective, because now I have my own money on the line. So that's definitely one of our focus areas this year and going into next year is going to be how do we get our members better tools in their hand that enable them to make quicker decisions on the spot.
So it sounds like you'd be a buyer potentially
Yeah.
for my, what I really want to see, which is TripIt for healthcare or TripIt for a personal health record. How many folks use TripIt? Yeah, a lot of people who travel a lot use TripIt because it's awesome. You get. I'm going to DC next week, so I've got a flight on US Air, hotel in some random hotel that I have no idea where the heck it is or how to get there. I didn't have to know any of that, and I got a reservation just email. I got a US Air PDF. I emailed them to plans@tripit.com, and now I've got a nice little calculator that tells me what time I have to show up at the airport, how I get from one place to the other. I can go by public transportation or what. All of that navigation is built in through a relatively straightforward technology. Once the data gets out of those systems and into a tool that innovators can really drive. So, and something that simple would be something that Blue Cross might be willing to fund for their members. A large ACO might well be willing to fund. It's I think the step beyond what Christina was showing earlier from their her community electronic health record. I'd love to see that, except I'd love to see as well the other health data that are coming in coming into a patient's health record. So. If somebody can build that and figure out the business model, although, because, Gina just signed up to pay for it, so there's your business model.
And you also just made me a TripIt customer, so
Exactly.
thank you.